The news came after a day of scant information and repeated lines. The Prime Minister's hospital stay was just a precaution, said Downing Street. Boris Johnson himself tweeted, "I went into hospital for some routine tests as I'm still experiencing coronavirus symptoms. I'm in good spirits and keeping in touch with my team as we work together to fight this virus and keep everyone safe." But the reality was his condition was worsening. Later on Monday, doctors moved him to the intensive care unit of St Thomas's Hospital in London.
During the course of this afternoon, the Prime Minister's condition worsened, and on the advice of the medical team, he was moved in to a critical care unit. So in light of those circumstances, the Prime Minister asked me as First Secretary to deputise for him where necessary in driving forward the government's plans to defeat coronavirus.
Support for the Prime Minister has come from across the British political spectrum and beyond. Terribly sad news, tweeted Keir Starmer, the new leader of the UK's opposition Labour Party. "My thoughts are with you and your family," said the EU's Brexit negotiator Michel Barnier. And from France's President Macron, "All my support to Boris Johnson, his family and the British people in this difficult moment." Here's a view inside one of Britain's COVID-19 wards, Bournemouth, on the south coast of England. Doctors and nurses are fighting to save lives here every day.
I have asthma, so it is scary, but we sort of have a duty to our patients, so it is the split between looking out for my own safety, but then also I'm a nurse, so my patients come first.
The UK's patient deaths rose by 439 on Monday, but many more deaths are happening outside hospitals. In London, specialist teams of police, fire and health services have been set up to respond to these.
We are anticipating about 30% of the mortality in London will be involving deaths within the community.
Government scientists say stay-at-home measures do seem to be working to limit hospital admissions, but it's still too soon to say how much.
We need a good long time series of data on all of these stages of infection in order to be able to tell what the impact of the measures that came in on the 23rd of March are going to be. It's too early to tell yet. We need people to carry on following those instructions so that we can work out 3 weeks later what actually happens in hospitals.
And it's still not known when the peak of coronavirus will be in the UK. Rory Challens, Al Jazeera.